Hi, so I am here to talk about hygiene during pregnancy. Um, there's a few things that are a little bit different during pregnancy. Obviously, your body's going to change some, and you're going to have a lot of the changes, like there's an increase in discharge from the vagina. And as long as that's doesn't have an odor or anything like that, that can be normal. You may want to change underwear more than once a day, or if it's a lot of discharge, or maybe wear a liner just to stay dry. And then when it comes to washing yourself genitals, you want to use some type of non-fragrance soap and no douching. Douching's been linked to some serious problems. It causes the pH in the vagina to get thrown off, and it also washes away the good bacteria that's living down there that we want to keep. So douching is bad, and you don't want to use any kind of perfume that will disrupt any the pH of the vagina. Oral health is really important during pregnancy. There's a lot of hormonal changes that's going to occur, and that can lead to bleeding gums, which can be normal. But it's really important to make sure you're keeping up with flossing and brushing, and if you're able to go to a dentist to get cleanings, that's good. I know some insurances will actually cover an extra cleaning for during pregnancy. If you're able to do that, then that would be wonderful. Another hygienic practice during pregnancy is to help lower the spread of infections. Upper respiratory infections can be more prevalent, I guess, when you're pregnant because your adaptive immune system is changing. So in order to try to avoid contacting any of these infections, it's really important to wash your hands. That's the major thing for any type of infection control, is washing your hands frequently for 20 seconds with warm soapy water, getting in between your under your nails and between your fingers and around rings and anything like that. Always wash your hands after you're changing a diaper or going to the bathroom or before you eat or anything like that. So another respiratory thing that you would want to watch is if you need to cough, or if you're around someone that's coughing or sneezing or anything like that, you want to try to sneeze, cough into your elbow. Try to avoid sneezing directly on anyone or being in the path of a sneeze or anything like that. Another change that's going to happen during pregnancy is your breasts are going to change. And the first milk that's going to come in is going to be colostrum. It's a thick substance that could potentially leak while you're pregnant. You want to just try to keep your nipples dry. If you need to, you could wear a pad or nipple pads. But the important thing is to keep them dry. You don't want to use any harsh chemicals or soaps on your breast either. But, just a regular shower and just keeping your nipples dry. If they're leaking, then you can wear the reusable pads. I thought were better than the disposable ones, but either one will work. The reusable ones seem to be a little bit more comfortable if there's enough leaking that you need to protect your undergarments. And that's about all for hygiene. I got these tips from 2 textbooks that I'll link below, and then a couple resources that I was able to find on hygiene and pregnancy and just overall infection spread and things like that is the CDC's website is full of information about hygiene, washing hands, respiratory hygiene, things like that. And also the March of Dimes has a pregnancy section, and in their complications section there's a lot of information about dental changes and changes in the vagina, breast changes and things like that. So you could check out those 2 websites. Those are full of information. Thanks.